Thank you very much. Thank you particularly for examining through this hearing the Office of National Drug Control Policies, coordination of national drug control efforts, and preliminary review of the drug control strategy by the government watchdog GAO. Congress creates agencies like this one. Congress appropriates money for agencies like this one. Congress, from time to time, passes laws for people to carry out, and so we're doing today our constitutional responsibility to make sure that the executive branch of government and this agency specifically carries out our laws according to congressional intent as required by the President to faithfully execute the laws under the Constitution. ONDCP was created to serve as our nation's leader in combating drugs. Since the inception in 1989, the threat posed by drugs have evolved. But the mission of the ONDCP and of this particular group of senators, the Drug Caucus, remains the same: to save lives. This hearing comes at a critical juncture for our nation. We're in the middle of the most destructive and most challenging drug environment that this country has ever seen. By now, we've all seen the numbers. So I quote again similar numbers to what the chairman quoted. The Center for Disease Control and Prevention reported that nearly 108,000 Americans died last year from drug overdose. This is staggering, and this ought to be unacceptable to any senator or any citizen in this country. Iowa is no longer no stranger to the drug crisis. Our towns and communities have been hit hard by the impact of lethal drugs. This includes meth, fentanyl, and now the spread of the deadly counterfeit pills. Fentanyl overdoses have become the #1 cause of death among U.S. adults 18 to 45. Overdose deaths from methamphetamine have tripled in recent years, according to the National Institute of Health. Common sense tells us that we need ONDCP to lead efforts and steer a national strategy that makes it harder to obtain and use fentanyl and its analogs, as well as meth, synthetic opioids, and any drug. We need to be focused on stopping the spread of these drugs, but I think ONDCP's 2022 strategy could do better at that. The strategy doesn't put enough emphasis upon scheduling fentanyl analogs permanently. Also, tackling counterfeit pills laced with fentanyl and meth is hardly even mentioned in the strategy. I'm concerned that the strategy's emphasis on harm reduction could allow for an even greater use of drugs. I'm also concerned that the strategy notes that ONDCP will take a review of where mandatory minimum sentences for drug offenses should be eliminated. This guiding document sets the tone for how our nation perceives drug policy and calls our federal and state partners to action. I'm worried that making drugs more accessible is what this administration calls drug control. I'd prefer if the strategy focused on the most lethal drugs facing us. We need to take and make it harder to get and use drugs and find areas where we can get real work done. I have a few ideas on that subject. The permanent scheduling of all fentanyl-related substances is just a mere start at my strategy. The ONDCP has supported class-wide scheduling of fentanyl analogs, and I hope that's still the case. Second, the Methamphetamine Response Act that I introduced with Senator Feinstein is now law, and I look forward to working with ONDCP on its implementation. Also, Congress can continue supporting prevention efforts like educating parents and children to stop access and use of drugs. But there's more work to be done. I look forward to hearing from the director today and discussing how we can work together to turn the tide. Thanks again to our witness for being here today, and I look forward to your testimony.